be delivering this event from the series of setting goals for the decade ahead, FIP Development Goals Digital Program 2021. And we will be talking about the FIP Development Goal 8, working with others. Next, please. I am Marwan Ael, and I am a project manager for workforce at FIP, and I am delighted to be moderating this event. Next, please. Some housekeeping for our webinar. The webinar will be recorded and will be live streamed via YouTube, and the recording will be available on our website at events.fip.org. You may ask questions using the question box provided, and you are welcome to provide us your feedback to webinars@fip.org. For those of you that are not members of FIP yet, please visit www.fip.org, go to membership, and register. Next slide, please. So this webinar is a series of setting goals for the decade ahead, which are webinars that go over the 21 goals, and we are doing 21 events till the end of the year. So the outcome of the 21 digital events is to mobilize global pharmacy development and transformation through the development goals. By engaging our profession, members, and colleagues everywhere, we aim to provide a description, direction, and context for each goal. And of course, we aim to monitor and evaluate through data evidence and to identify priorities across practice, science, workforce, and education. So, we have had delivered many of those events till now, and we're still having another DG event by the end of October, 2 in November, and we are closing the year with 2 events in December. So be there. And for all of you that didn't have the chance to go over the previous webinars, you can check them on the FIP website. So the outcomes of our webinar today is to describe the FIP goal and to explain its 3 elements: workforce education, science, and practice, to showcase the tools that FIP have, and to identify priorities across practice, science, and workforce and education. We will be having speakers talking about their experience in working with others in all these elements, and of course, in settings. And we will try to engage our members in an activity at the end to support the evaluation of the goal through data and evidence. We are happy to have a group of speakers that will be discussing with you their experience in different settings of pharmacy. We'll be having Silvana Lete from Brazil, Astrid Chock from Switzerland, Jill Boone from USA, Dara Connelly from Ireland, Susan James from Canada, Mujahid Valji from Tanzania, and Victoria Garcia Cardenas from Australia. Welcome everyone, and thank you for being here. The one FIP goals is that we cannot have pharmaceutical care without a pharmaceutical workforce. And we can have no pharmaceutical care without a scientific foundation for the next decade. And that's why it's important to tackle always the workforce and education, the practice, and science all together. So the FIP development goals are 21. We have delivered many of these events, and we're still going to deliver the remaining ones from till the end of this year. We will be having now a small video about the development goals. Today's development goal is development goal 8, working with others. So, as you all know, for all development goals, we have 3 elements: the workforce and education, the practice element, and the science element. And in the coming slides, I will be going briefly over the description of the element and the mechanisms. We will be starting by the workforce and education element. So in the next slide, we can see that this element will clearly identify elements of collaborative working and interprofessional education and training from the workforce development programs and policies. The mechanisms of this element is to evidence of policy formation to demonstrate how healthcare professionals can develop and engage in partnership in order to achieve better health outcome, to develop education and training strategies and programs to ensure collaborative work, and this should all be linked to formal professional development activities. Next slide, please. For this development goal, we have a group, the DG8 group, which is formed from the members and the leads of this group are Jill Boone, Astrid Chalk, and Silvana Leti. And this group has also developed many tools and is also having a workforce reference guide for this development goal. And the guide allocates all information, evidence, and expertise from FIP to support our members with measuring the progress, evaluation, implementation, and transformation processes related to DG8. And in order to access the full workforce reference guide for this development goals and other development goals, you can go to the fip.org and to go to the workforce reference guide. Next slide, please. Now we'll be talking about the practice element, which clearly identifies elements of inter and intra-professional collaboration and multidisciplinary healthcare delivered through cohesive and interdependent teams working across interfaces and transitions of care. So it's here where in practice we collaborate with others in order to provide the best health outcomes and health services for the patients. On the next slide, we'll be going over the mechanisms of this course. And as you see, the mechanisms are a lot for practice. We will try to develop structures and systems for multidisciplinary intra and interprofessional teams for all healthcare cadres to work together and coordinate in order to deliver the care, to work across interfaces and transition to the health system, to ensure continuity of care between levels of care and care journeys through mechanism of appropriate communications and health data sharing, to support the development of policies where pharmacists and support workforce are key actors in collaborative practice and integrated care, to work with others, stakeholders, agency, and other healthcare professionals, to ensure engagement with patients, to recognize own professional autonomy, leadership, equal responsibility and accountability with other health professionals, recognize collaborative practice as a quality indicator for care delivery and capacity improvement, and to develop and implement intra and interdisciplinary programs for workforce willing to change from practice to science and vice versa, and to develop career paths in associate. So we go now to the third one, which is development goal element for science. And this is a transdisciplinary collaboration to advance education, research development, manufacturing, and regulation that collectively improve access to medical products. And in this element, we have different mechanisms like establishing opportunities for pharmaceutical scientists and clinical practitioners to collaborate, broaden pharmaceutical science education by integrating other disciplines to contribute to innovation, development, and manufacturing and regulations of medical products, and to foster transdisciplinary collaboration by enabling trainees and early career researchers to work as mentors from different fields, including scientists. We go now to our speakers. We will start by results from review of the literature on interprofessional education. The first speaker is Silvana Leti. Silvana is a pharmacist and the holder of PhD in public health. She's a professor at the Universidad Federal de Santa Catarina in Brazil. She's a FIP advisory group member and leader of national research and social engagement projects. Silvana is FIP lead for DG8 and a member of the Workforce Policy Committee of the National Health Council. Silvana, the floor is yours.
Thank you, Marwan. Hello, everyone. So it's an honor to participate in this great panel today. I would like to thank FIP and my colleagues from the Workforce Development Hub for this opportunity, and particularly my partners in the number 8, Astrid, Schock, and Gilbon. Today, I will share with you some preliminary finds of a scoping review of recent published experiences of interprofessional education in pharmacy education, aiming to define the educational, institutional, and systemic factors involved in the development. So we can have a broad view of interprofessional education offered to pharmacists and pharmacy students. This review was performed by the PhD candidates, my student, Ana Carolina Machado, in the postgraduation program of Pharmaceutical Policy and Services here in the Universidade Federal de Santa Catarina, no Brazil. And we have the collaboration of some colleagues, Claire Anderson, Astrid Schock, and Gilbon. To start, it's important to say that the definitions of interprofessional education and interprofessional collaborative practice have been released by the World Health Organization and many health and education stakeholders, promoting the engagement of students to learn with and from each other, to enable them to collaborate effectively in practice to improve health outcomes. Interprofessional collaboration occurs when professionals develop and maintain interprofessional working relationships to provide optimal health outcomes. The International Pharmaceutical Federation assessed that the future of pharmaceutical education requires enhancement of professional standards worldwide, and stated that pharmacists should learn to work collaboratively with other healthcare professionals and scientists in medical, scientific, and social fields. Interprofessional collaboration or collaborative practice is nowadays recognized as an important professional competence for pharmacists. However, in pharmacy education, there are only a few analyses of interprofessional education experiences. So as methods, we did a scoping review of the literature according to Axey and O'Malley 5-step methodology. We searched 6 databases, and articles published between 2014 and 2019 were selected. A total of 147 studies were retained for the scoping review after the inclusion and exclusion criteria. The conceptual framework called Interprofessional Education for Collaborative Patient-Centered Practice, developed by Damour and Oldenson, was applied to shorten the data. So what finds did you get? The first highlight is that the activities most took place in the United States, or the published activities were based in the United States, most of them. And we find an increasing number of studies published during these 5 years. The first level of analysis was about educational factors. We found that the most used method was practice-based clinical placement learning, followed by simulation-based learning and mixed methods. Of all the experiences, only 46 involve real patients. Most of the experiences were face-to-face in that time before COVID-19. And based on the university infrastructure itself, or at an outpatient clinic or hospital. 43 experiences referred as a pilot projects, not a settled project. The activities developed were concentrated in undergraduate courses and has students as target audience, followed by multi-level teams, and only 7 experience for pharmacists. So interprofessional education is in continuing education and continuing professional development was not so common. The professional careers that participated in the experiences along with pharmacists and pharmacy students are mostly medicine and nursing. The second level of analysis was focused on institutional factors. It is worth it to point out that only a few studies described organizational factors in the development of interprofessional education. 45 of them reported the curricular or mandatory nature of the interprofessional education experiences, and 12 experiences were reported as being only elective. 35 cited the existence of some type of funding dedicated to development of these experiences. In 59 articles, they reported that there was one or more formal leaders in the institution responsible for the development and implementation of interprofessional education. Some studies also review barriers and facilitators related to the educational organizations. So they cited time-consuming and no dedicated payments as barriers, difficult to organize common schedules between diverse courses, infrastructure, particularly physical space, and also the educators' reluctance to change, changing practice. And as facilitators, the key facilitators in the development of interprofessional education, they cited were the support from the university, the existence of interprofessional leadership, and shared goals and vision within the university's departments. So finally, we also analyze the systemic factors. These are the political, economic, and social scenario that authors of the studies pointed out as important conditions for the development of interprofessional education. They were related to health systems and providers' incentives in the professional education as a tool to meet the health needs, the influence from regulatory institutions and professional bodies, and the perceived need to develop interprofessional education experiences in the country or region and to evaluate the existing experiences. Next, please. So as conclusions, you can see a large number of eligible studies represents a positive result. We have good experiences published. There are still weaknesses in the institutionalization of interprofessional education, including pharmacists and pharmacy students in universities, with limited forms of support. Many pilot projects with low workload or no regular offer, which limits their ability to produce results of greater impact in health practice. It's imperative that government and professional and educational leadership entities define clear incentive, regulation, and support policies in favor of interprofessional collaboration in education. So you can see that without organizational and political support, the impact capacity of interprofessional education activities will be reduced and changes in practice will only occur in a very long time. So those are just preliminary findings, a few words about this revision that can help us to understand and to have a broad view of what people are doing in interprofessional education, including pharmacists and pharmacy students. So in the next slides, we just would like to acknowledge the FIP Working with Others group and my program of post-graduation program and my research group. So thank you, Marwan.
Thank you, Silvana, for this presentation, and thank you for the update given about what the literature is offering about the IPA. So our next speaker will be speaking about working with others as a pharmacist in science. Our next speaker is Victoria Garcia Cardenas. She's a senior lecturer in pharmacy at the University of Technology, Sydney, associate editor for research in social and administrative pharmacy. She is currently involved in 5 national and international research projects and the chair of the Pharmacy Practice Research SIG at FIP. She's an active member of the Pharmaceutical Care Research Group at the University of Granada in Spain. Victoria, the floor is yours.
Thank you very much, Marwan, for the introduction, and thank you for the opportunity to present in this very interesting and relevant webinar. Today, I will be sharing my experience of pharmacists working with others in research environments. So there are many examples of pharmacists working with others in science. So as you can see on the slide, usually we work with peers, either locally and international, with the objective of doing research collaborations, supervisors or trainees, early career researchers, or students with mentoring and training purposes, stakeholders, agencies, and other healthcare professional associations with the objective of promoting legislative change and development or practice change in pharmacy. We also collaborate with pharmacy practitioners, other healthcare professionals, and also patients, especially in applied research environments. We also collaborate with researchers from other disciplines. So, for example, other healthcare professionals, statisticians seeking for specialized knowledge and skills. And we also collaborate with reviewers, journal editors, with the ultimate objective of disseminating our research outputs. So as you can see on the next slide, there is no doubt that science has a key role in developing and supporting evidence-based practice of pharmacies in a range of settings, and also contribute to the advancement and improvement of pharmacists' education and workforce. So as highlighted by FIP, collaboration between scientists, practitioners, and education is key to support the advancement of the pharmacy profession. So if we go to the next slide, you can see that pharmaceutical sciences involve the discovery, development, manufacture, and use of safe, effective, and quality medicine and medical products. With such a wide range of activities, everyone can imagine the different collaborators pharmaceutical scientists can have. Lab technicians and pharmaceutical industry stakeholders in basic research, clinicians and epidemiologists in human research, pharmacoeconomists in pragmatic research, or implementation scientists, patients, policymakers, and practitioners. It should be noted that collaboration with professional organizations such as FIP is also key due to their closeness to the reality of daily practice, and this is extremely useful to help anchor the research agenda in the needs of patients, pharmacists, and communities. So if we go to the next slide, no one doubts that a key element for the future viability of the pharmacy profession is the development of new professional pharmacy services and the implementation of evidence-based ones. So from a pharmacy practice research point of view, and to achieve this ultimate objective, pharmacists need to work with others with different objectives. So for example, when you think about developing or identifying needs that are currently not met by the healthcare system, social scientists and epidemiologists can assist in this identification, subject to be addressed by pharmacists in different healthcare settings. So once an unmet population need has been identified, the service needs to be developed. So in this sense, for example, co-design is increasingly being used in healthcare settings, including pharmacy, to increase the participation and engagement of a range of stakeholders in the development of health services. The stakeholders can include individual patients or other healthcare professionals, groups, organizations who may influence or be affected by decision-making of a particular action, aim, or policy. the evaluation of the service after it has been designed, and its future implementation also involve working with statisticians, pharmacoeconomists, practitioners, educators, or policymakers, amongst others. If we go to the next slide, you will be able to see that within this environment, it is key to communicate and disseminate the outputs generated from the research. So this is key to disseminate knowledge, evidence-based, support evidence-based practice in pharmacy, and also translate findings into workforce and education of new pharmacists. Some examples of these communication channels include scientific journals, using papers, communication to conferences such as oral presentations, posters, training activities, webinar, lectures, social media, which is increasingly being used, such as Twitter, Facebook, and other channels. And finally, if we go to the next slide, you can see the resources that FIP has to support the DG8 implementation in science. So the main resource is the Board of Pharmaceutical Science, whose mission is to serve as the leading international forum for the promotion of scientific interchange among pharmaceutical scientists, education in the pharmaceutical sciences, and also the advancement of the pharmaceutical sciences globally. So to achieve this objective, the BPS has 6 seats. As you can see on the slide, drug delivery and manufacturing, new generation of pharmaceutical scientists, the SIG in new medicines, personalized and precision medicine, the SIG in pharmacy practice research, and the SIG in regulatory sciences and quality. So all these 6 support the development of different training activities such as webinar, dissemination of information, and conference. So I encourage all you to work with these 6 and engage in the activities. Thank you.
Thank you, Victoria, for your presentation and for highlighting the role of the pharmacist in working with others in science and research. We go now to our next speaker, Dara Connelly, who will be talking about working with others as a pharmacist in the community pharmacy. Dara is the interim president, community pharmacy section at FIP. He was elected as the president of the Irish Pharmacy Union in May 2016 after serving a term of 2 years as a vice president. And he was selected, he was the section lead for the CPS Vision 2025, Pharmacist at the Heart of Our Communities. Dara,
Good morning, colleagues. It's indeed a great pleasure to be asked to be part of this fantastic webinar this morning. I was delighted to be asked because working with others is what gives me my greatest thrill as a community pharmacist. But I think as every pharmacist and pharmaceutical scientist around the world will attest, it also is something that drives me nuts at times. So rather than be the person who's continually complaining about stuff, I think it's important to see where we can make interprofessional collaboration and working with others better. I want to, as part of my talk today, focus on the resources that already exist within FIP, and in particular, the community pharmacy section vision for the practice of community pharmacy around the world, which was brought to Congress in September of 2020. So on my first slide, what you can see is the cover. And as you will know on the cover, you have community pharmacies and community pharmacists from all around the world. And the first thing to recognize is that our doors are open, and our doors are always open in community pharmacy. And that was never truer than it has been through the COVID-19 pandemic. What I also know as well about having an open door is that you don't always necessarily, you're in a position to predict who's going to come through the door or who you will find yourself working with, who the other will be. But that's the beauty of community pharmacy practice. So on my next slide, we have in our CPS Vision 2025, we focused in on what exactly is essential pharmacy care. And for today's talk, I want to focus on 2 things. I want us to firstly have a recognition of who we are as community pharmacists, that we must recognize our capabilities and our potential in order to work with others. and that we must see how we work with others as part of us being in a community of people we care for, but also in a community of people that we work with, the interprofessional collaboration and cooperation that we exercise every day for better patient outcomes. So on my next slide, I find this slide very, very useful because it's very, very neat. When we look at the unique role of the community pharmacist, we are involved with working with other healthcare professionals in the continuum of care, from major trauma, when somebody leaves major trauma and then they come back to the community. You may be dealing as a community pharmacist with that trauma center. As we work our way down, we have people who have sometimes acute but often chronic psychiatric care. They need to know that within their community, they have a community pharmacist who can look after them. We have acute conditions, chronic conditions, we have minor ailments, and then we go down to daily choices and lifestyle and prevention. A community pharmacist is uniquely positioned to be able to help others by working in an open door environment that is the community pharmacy. Behind each and every one of those arrows, though, we have other professionals that we work with in the healthcare setting. And by understanding how we can best help our patient, we can then start to understand how we can best work with those other healthcare professionals. The other aspect of the care that we provide as well is that we often, as I think it's our Australian colleagues came up with a very good term, are involved in caring up and caring down. So it may not necessarily be the point of interface we have with the other, be the patient themselves. It can often be a carer for the patient. So that could be a parent or it could be a child looking after an elderly patient. On my next slide, we have found it really important as community pharmacists to look at what we do already and what our heritage is. So this is just taken from that larger diagram that you saw, which is in the CPS vision, that we can see within this, that we have already recognized that we have a unique and independent profession. And as community pharmacists, we feel that that's really important to the work that we do, and that we build trust with the other people that we work with, be it that interprofessionally or the patients that we care for. But we also recognize that that's built upon ethics and values, educational professional standards, and that ultimately what this needs is a concordance, that we need to know that we have the trust and we have the cooperation of the people that we work with, the others. On my next slide, we have also then looked to what the future of community practice and how we can best work for people and what that will involve. So at the top, you can see that there's self-care is there, and that goes back to the slide that I shared with you. But we must also look at the new opportunities we have for working with others. So that involves new communication streams, which have become really important during COVID as we move towards digital prescribing and digital dispensing. We must look to innovative therapies, integrated care, and pharmacogenomics. So in the context of today's talk, I think it's really important that we understand what integrated care is, and that working with other professionals is really, really important, and that we must be open to doing so. On my next slide, we then, as a one FIP document, we need to recognize that pharmacists in the community have an underutilized skill set. But more importantly, we know that patients want us to do more, that we have proven improved outcomes for patients. And then we must also recognize that the demographics of the populations we serve, but also the demographics of the healthcare professionals that we work with, are also changing. So in a nutshell, what we are able to do by being part of one FIP, and as we see as example today by working with colleagues who are their special interests are in different areas of be it of practice, be it of research, we can see what best we can do. But ultimately what that's about is that the key to working with others and doing best for others is to listen to what others need us to do for them and how we can contribute as community pharmacists. My final slide, I would sum up by saying what's really important about working with others is to be open to opportunities and to go out and do it. I was really proud to be able to say on World Pharmacists Day that as a community pharmacist who's involved in a cooperative of community pharmacies, we joined up with the Irish National Adult Literacy Association, and they are a group who help people who have issues around literacy to get more value from the day-to-day interactions they have with other people. So what we were able to do by working with others, by working interprofessionally with the National Adult Literacy Association, was to recognize that somewhere between 20 and 25% of the people that we work with to get them the right medicine at the right time have issues around reading labels and understanding healthcare advice and healthcare information. We put together a program called the Crystal Clear program to make sure that every community pharmacy in our group has reached the standard of understanding to be able to deliver more for those others, those people, that 20, 25% of the people that we look after. And by this interprofessional cooperation, I think really sums up the key of development goal 8 of working with others, is to see opportunities and to see how we can do more and do better. Colleagues, thank you.
Thank you, Dara, for this presentation. And we go now to working with others as pharmacy technicians. We are welcoming now Susan James, lead for the FIP Pharmacy Technicians and Support Workforce, Strategic Platform and Chair of the Pharmacy Technician Advisory Committee. Susan is the Director of Quality at the Ontario College of Pharmacists, the regulatory body in Ontario for pharmacists, pharmacy technicians, and pharmacies. Susan works on the integration of pharmacy technicians within pharmacy practice locally, nationally, and internationally. Susan, the floor is yours.
Thank you very much, Marwan, and also my thanks to FIP and to the team of the DG8 team working together to include me and allow me the opportunity to speak with people today. I'm following up a little bit on the slide that you just saw from Derek, which was the acknowledgement and recognition of World Pharmacist Day, and am delighted that today's session is falling on Global Pharmacy Technician Day. So I say, congratulations and thank you to all of the pharmacy technicians and other individuals in the pharmacy support workforce who I know we have many on the call today that are celebrating this day. There are multiple different kinds of activities, as you've just heard, the sort of thing that has been described in one country. I know that there are throughout the world today many activities that are going on to recognize the contribution of pharmacy technicians. You'll also see on this slide that we have included what is the acknowledgement of our Pharmacy Technician Symposium. And so we are delighted that this session is actually the first part and the kickoff to our Pharmacy Technician Symposium for 2021. We will have various sessions that are going on, and I know that Marwan's going to speak to that a little bit more towards the end, so I don't need to tell you more about it, but I do hope that you will be able to join us. Well, I'm going to provide you a few comments about working together, what we're doing at FIP in terms of the pharmacy technician and support workforce in this area. If you are able to join for some of the sessions over the next day and a half, you will see that there are multiple examples of the work that is going on, particularly in the practice area, and they will be individuals that are very keen to share with you what work they're doing. So I'll let Marwan give you the details about how to join us with that. But for now, let's move on to the topic that I am here to speak about today, which is that of providing a pharmacy technician perspective. So if you take a look at the next slide, you'll see that one of the important things is to understand who are we talking about when we're talking about pharmacy technicians and other pharmacy support workers. They're not all called the same thing globally. You'll see here a word cloud that has come from a study that FIP was responsible for and released in 2017. The different kinds of titles that came in. There was a survey connected to this study, and we were asking what are the different terminologies that are used to describe technicians and pharmacy support workers. So here you'll see there is great variety, and the variety will be dependent on the country, perhaps, that the individual is working in. It may be that it's more local and regional in terms of the terminology that's being used, or we even find that within similar settings and within one organization, perhaps there will be some of these different individuals. There are times when the same term or when different terms are used to describe the actual same work. So for example, in a community pharmacy, you might be working with someone who is going by the definition of a pharmacy assistant, and somebody else in another community pharmacy doing exactly the same kind of work that is also using the term of a technician, dispenser, or a pharmaconomist. So it's important to just recognize that globally there are many differences. And you'll see on the next slide, and I think also important in terms of understanding what's going on with pharmacy technicians, is the recognition that globally there is great variety in so many of the different characteristics of this particular member of the workforce. And it's these differences that will sometimes impact the kinds of working relationships they have, the extent of those relationships, the extent to which they are working with patients, the size and type of pharmacy team that they're working with, as well as the type of healthcare team that they might be members of. So you can see that where you have roles and responsibilities that perhaps are very defined, and where supervision is much more direct and within the under the supervision of a pharmacist, that perhaps it is going to be more narrow. And certainly we have individuals that are engaged in much more independent practice that will be in large teams that are working in environments that are going to have a much broader group of individuals that they are working with. I think, I give examples of, again, if we think about in community pharmacy, where there will be individuals whose role is very much in the background, that may be around much more of the supply and distribution, working on billings, those kinds of activities where they may have more of a back end role, and others that may be providing much more direct patient interactions where they are engaged in interfacing, providing education about the medicines, doing that release of the product directly with the patient or with the caregiver. In many ways, these really are just no different than the variety of things that we see globally with pharmacists. I think that that's one of the key messages through this, is recognizing that the kind of breadth and types of relationships that we see with the pharmacy technicians and support workforce are very similar to the breadth that we'll find within the pharmacy profession itself. On the next slide, you'll see that I'm going to talk a little bit about the work that we are doing at FIP in this regard. And I think to let you know that we do have an advisory committee that is for pharmacy technicians and the support workforce. It is a part of that strategic platform within the Workforce Hub. And you'll see here, this is a group that started in formally in the fall of 2019. The aim really is to provide informed guidance and expert advice to make sure that we really are advancing the practice of pharmacy technicians and the support workforce. The group works with a number of different working groups. You'll see them here. There are 4: the events and symposia, engagement and advocacy, evidence and resources, governance and strategy groups, and an overarching advisory committee. We've actually grown even from where we have this here. There are well over 30 members to the committee now. We are representing over 18 different countries. It is something that we encourage more and more people to join. It is just a matter of being an FIP member. We have working together, pharmacists and pharmacy technicians and other support workers on this group. And the work is very much aligned with the DG goals throughout FIP. More and more, we are working in combination with other activities that are going on and some of the broad platforms. So, very excited in the newest one in the non-communicable diseases. We also have now just entered into the platform with pharmacy technician support support. And so more of those kinds of working relationships, even with the FIP, are growing. If you move on to the next slide, I'm going to just share a little bit from the DG8 goal, which working with others and recognizing that pharmacy technicians and support workers are related to all of the different areas that you have just heard about. Just to share some of the specific activities that we are involved in right now in these areas. Under the workforce and education element, we have two new projects that we're very excited about. Both of these are working with others within FIP. We are developing a glossary project, which is to establish an understanding of terminology. And as you saw earlier, there is a lot of different terminology in terms of titles, but also the differences around education levels, etc. And so this project is going to be very important. One of the things that we know about working with other people is the more we understand about other people and can recognize ourselves and see based on the terminology how we align, then we're able to work better together. The second project here is a competency framework, and this also is the first global competency framework for pharmacy technicians. There are other frameworks that FIP have developed already, and so again, we will be working and building on the expertise of FIP in this area, but producing a framework that will assist others in understanding what those competencies look like and the continuum of competencies for pharmacy technicians. When we talk about the practice element on the next slide, you'll see that we have, as a part of our work, digital events and symposium that, as I said, we are kicking off today. We have been hosting different digital events throughout the year, as well as some of the other FIP areas. And this has provided us with great opportunity to really showcase a number of the pharmacy technician roles and contributions that they're making in different countries in a variety of different settings. And as I've said, we will continue with those over the next few sessions and opportunity to hear about what's going on in that regard. We also have established a web page that is also allowing for some networking opportunity for other individuals to understand the contributions of this particular workforce. It is a page that we are continuing to grow, where we are showing research efforts. We have commentary that we have just released that is there to talk about some of the work that is going on in this space. And again, just opportunity to bring together and help people understand contributions and the areas where pharmacy support workforce is working with others. I think that you've just heard about the practice element. I'll speak about it in a moment, but certainly all of those different environments that you've heard pharmacists are practicing in. Likewise, there are pharmacy technicians and support workers. And the last element here is the science element. And of course, this is a little bit less evident in terms of the role of the pharmacy technicians and support workers, but you did hear Victoria talk about in the number of different players that they are working with as well. It does include the pharmacy support workforce. Our digital events and our web page, as I said, we are looking at demonstrating the public research publications that are showing where there is evidence about the role and the contributions of pharmacy technician workforce and to the evidence towards pharmacy practice in general. You'll also find that there are pharmacy support workers that are dealing with clinical trials. Often they may be involved in the drug preparation, administration of medications in some of those cases. They are working in regulatory environments, in audit roles, very often in manufacturing, and certainly as research assistants. And part of our webpage is to encourage people to see the kind of research that is going on and encourage pharmacy technicians themselves to become engaged in that work. So those are the things that we are doing as a part of the Pharmacy Advisory Committee. And if we move on to the next slide, really to say that pharmacy technicians are working where pharmacists are working, not always together. There are some instances where we know that there are pharmacy technicians and support workers that are working on their own in situations where there is not the availability of a pharmacist. We hope that those are becoming less common situations, but certainly that is the case. where there are technicians working more independently. But for the most part, they are working side by side with pharmacists to share what is this common goal of creating a health system and contributing to our universal health coverage. Pharmacy technicians working very much with patients, with families as well, in all of these different roles. And I think that it's interesting to note that in many cases, we have pharmacy technicians that talk about how they are oftentimes the first individual that may be working with the patient or with the family as they begin to collect information and engage in that relationship, introduce those individuals to the pharmacy world. So I'm going to wrap up with just a little bit of information that comes from closer from home. On my next slide, a couple of statements that are made from individuals that are in our local area that are in response to a very large initiative in Canada that we were taking on, and in my part of Canada in Ontario, where 10 years ago, more than 10 years ago now, we were transitioning and recognizing pharmacy technicians as a independent professional to be regulated along with our pharmacists. And you can appreciate a very significant transition, something that again is happening throughout various areas in the world as we try to integrate and have pharmacy technicians and support workers working much more closely together. And as we have moved through this, we have recognized that it's not always been an easy journey. This idea of working together does have its complications. A couple of the observations that I would make in particular in terms of bringing together our two professions is just that challenge sometimes of needing to recognize and understand the importance of our roles, that we are together in this. This is not about one versus the other. That is the coming together and working together towards that common goal that is most important. Where we have seen that it works particularly well is when there is a great understanding of the roles, when there is confidence in both of these individuals to be able to demonstrate what their competencies are, when they are in environments, excuse me, when they're in environments where there is not competition for the work. And I think that more than anything we have seen in this past 18 months during COVID-19, that both of these individuals have been tremendously important. And so as pharmacists also through COVID-19 have been able to demonstrate their worth and their value, the importance to the overall initiative, pharmacy technicians and support workers have been right there as well, have been able to step in and be alongside. I think the vaccination effort is a great example of where these two individuals have been able to come together and support each other to provide that most important service. And so with that, I will say thank you, Marwin, for having me, and we'll address any other questions as we get to the panel. Thank you.
Thank you, Susan, for this presentation. We go now to working with others as a pharmacist in hospital practice. We are pleased to have Mujahid Valji, who is a clinical pharmacist, and he has been working with Aga Khan Hospital at Dar es Salaam for the past 13 years, and currently he's the chief pharmacist at Aga Khan Health Services in Tanzania. He has been part of the FIP Hospital Pharmacy Africa region for the past 3 years, coordinating the activities for Africa region. Mujahid, the floor is yours.
Yeah, good morning or good evening, wherever, whatever the time. Hi to all. Okay, I am Mujahid, and I'll take you through the responsibilities or how pharmacists in the hospital section collaborate with others in different activities. So to take you through, I will just so Aga Khan Hospital, where I work, is one of the is the only hospital in Tanzania that is Joint Commission accredited, and one of the chapters of Joint Commission is Medication Management and Use, which deals with the use of medications. So in that section, and the reason why I'm taking you through this cascade or this activity is what defines what a pharmacist does in a hospital setup, and in these activities is what it makes them they have to collaborate with other health professionals within the hospital to carry out these activities. So in medication management, the first part, which is very important, is the selection of medication. Okay, whereby there is a way whereby the formulary is upgraded or selected, and new drugs are added or removed. Thereafter, once you have selected a drug, then you come to the point of procurement. Okay, how are the drugs procured continuously to ensure that drug availability, their sustainability. So that again is a process whereby pharmacists are involved. Thereafter is the storage. So once you have procured the drug, you need to store them to ensure that they are within the required temperature and humidity, and the issue of expiry as well. Thereafter is the preparation and dispensing. Okay, in fact, first comes the prescribing. So thereafter comes the prescribing part, whereby the drugs are prescribed and or transcribed for that matter. Thereafter, they are prepared and dispensed, and finally they are administered. But it doesn't end there. Thereafter, we have the monitoring, evaluation, and the education. So this is why I am elaborating on this. This is the whole process in a nutshell. This is what a pharmacist or a farm tech, because in our setting in most of Africa, we don't have enough pharmacists, so we have farm techs who assist us in our activities, and we train and supervise them. But there are some instances where they even work independently, again by remote supervision, because of, let's say, non-availability of pharmacies, or maybe the area where they are, we don't have enough pharmacists. So this shows in a nutshell what a pharmacist does. Now, when we need to carry out these activities, whom do we need to work with? So we need to work very closely with doctors, because they are the prescribers. And even in the selection process, we work very closely to select the right drug. We work with the nurses, because they are the administrators for inpatients, okay? And even in the monitoring and evaluation part, we need to work with dietitians as well, physiotherapists, with procurement officers, right? The procurement availability and ensuring that the drugs are there is even an important factor. Hence, we need to work very closely with the procurement team as well. And then obviously the quality aspect, whereby all of this is regulated. We have our KPIs, key performance indicators. We have our improvement plans. So all this, we need to work very closely with the quality team. So I'll just take you through each and every aspect and elaborate.
Mujahid, you're on mute, please. So may you unmute yourself.
Sorry, next slide, please. Okay, so now the first part is we are part of the multidisciplinary team for patient care. So here is a pharmacist as a clinical personnel, okay? And we work very closely with the doctors, with the nurses, with the dietitians, physiotherapists, including the lab, okay? Including the laboratory, because we need to read the lab results. So in here, what do we do? A pharmacist in the patient care process has to collect information, be it different resources. It could be medicine reconciliation on admission or discharge, whenever they're being transferred from one care to another. Then it could be lab results. It could be past medication history. It could be many things that that data that a pharmacist collects. They have to assess it, okay, based on the patient. They have to assess the data. Then they have to plan out how does that how do we plan the treatment now based on this data that we have obtained. We have to implement it, okay, advise on the treatment model, and follow up that which we have implemented. Has it worked? How is the what are the outcomes? So this is in terms of clinical pharmacist being a clinical personnel, working very closely with doctors, nurses, and other allied health professionals to ensure, and procurement. Why I mean procurement is we need to work very closely to ensure that there is availability of the drugs at all times, especially critical drugs. so that we can plan the treatment accordingly. So now this happens at two levels, both at inpatient and outpatient, right? And outpatient, it could even be the community pharmacies and other aspects. Next slide, please. Sorry, next slide. Okay, then comes the pharmacist being part of policy making and monitoring. Sorry, have we skipped any slide or is this the second one? Okay, so fine, thanks. Okay, so this is again, pharmacist in a hospital setting is part of a policy making and monitoring activities. So pharmacists don't only work as clinicians, they are part of committees like Pharmacy and Therapeutics Committee, which is a multidisciplinary committee consisting of doctors, nurses, dietitians, and other allied health professionals who sit and discuss. And one of their tasks is to, for example, look into the new drug requests, to look into the monitoring aspect of drugs and other aspects of the JCI as stated. So the point being is we work as a we need to be part of this committee's ASP, which is the antimicrobial stewardship program. Okay, again, antimicrobial resistance and all that is even another whole topic of its own. So we are an integral part of this committee. We have prevention and control of infection, which is very much related to the antimicrobial resistance. We have quality management system. So we always have to improve, and a hospital system relies heavily on, relies quite a bit on the pharmacy, because the treatment, most of the treatment do require drugs. So again, we come in, and that's where we have to be part of the quality management system. And as an external as an external activity, which might not be related only to the hospital, but beyond, is policymaker in regulatory and other organizations, like it could be the Food and Drugs Authority, or it could be the professional body Pharmacy Council, whereby we have a say and advise them, because we are the ones on the ground carrying out these activities. Next slide, please. Okay, we also work very closely with the IT team, information technology, because we need to upgrade ourselves. During COVID, we needed to be innovative, and this is a part of innovation, right? And in artificial intelligence, because during COVID, people could not go to community pharmacies, so we had to improvise home delivery of drugs, service. Okay. But we had to ensure that we are abiding by the laws of the country, because we needed to have a valid prescription, and then we needed to have dispensing at the time of dispensing counseling of patients. So all these things needed to come in with the help of the IT. So again, we work very closely with IT, and even to integrate the hospital management information system. So it is very important. IT are very essential, and they are very instrumental tool in enhancement of pharmacy practice in the hospital. Next slide, please. We are even part of the research team. So whenever research and research papers, proposals, or concept notes are being developed, we are involved, because whenever it relates to medication, and where one of the interventions is medication. So that is where, again, the pharmacists come in. We are involved in the initial phase, in the implementation, and the outcome, whereby we monitor data collection. And so in this way, we work very closely with other health professionals, with the finance, with the who are developing the budget and the like. So that's another aspect that a pharmacist works in the hospital setup. Next one, please. Human resource manager. As you know, pharmacy has different cadres. There's a pharmacist, and there's pharmacist technicians. We have assistants, and in Tanzania we even have something called ADO, accredited drug dispensing outlet. So these are for very remote areas where even getting a technician is difficult, or technician would not go because of the incentives there. So we have very small drug outlets which cannot stock all drugs, only certain types of drugs. And they are again regulated and remotely supervised. So all these in a hospital setup, coming back to the hospital setup, a pharmacist has to manage the human resource in terms of training, in terms of continuous professional development, in terms of supervision and assurance that the SOPs are carried out. So we work with pharmacy technicians, and pharmacy technicians are very instrumental in assisting us to carry out our duties. We work with clinicians in clinical decision making and other activities. We work with trainees, so we have field students, we have interns, so we need to train them, we need to upgrade them. So in all of this, we need to work very closely with the HR department to ensure that we have the right people and the right training is carried about. Next slide, please. Another aspect of a pharmacist in a hospital is the...
Excuse me for the interruption. We still have 1 minute, please.
Okay.
Yeah, thank you.
The other aspect is the financial management. So again, you know, in a hospital setup, a big, especially in a private hospital, quite a huge revenue comes from the pharmacy department. So we need to work in that aspect as well to ensure that there's sustainability in the financial management of the hospitals. Next slide, please. And this is a view of our hospital in Dar es Salaam, Tanzania. So those who come to Tanzania, karibu sana. Thank you.
Thank you for this presentation. We go now to Astrid Chok. Astrid has a Master's of Pharmacy and PhD in Pharmaceutical Chemistry. She was Department Head for Science, Education and Quality in PharmaSwiss. She was appointed Fellow of the Swiss Academy of Pharmaceutical Sciences. Astrid is the CEO of Qualicare, and she also works for the Swiss Society of Endocrinology and Diabetology. She's FIP lead for DG8. Astrid will be presenting Working with Others in Patient-Centered Practice Projects. Astrid, the floor is yours.
Hello, everybody. I'm allowed to explain to you now to work in the practice and have, as a CEO, I want to present QualiCare, the association. QualiCare is a very special association. It's an interprofessional association, it's non-profit, and it comprises all stakeholders from along the patient care pathway. We have member organizations from the healthcare providers, we have health insurers, we have cantonal authorities, healthcare authorities, we have patient organizations, we have representatives of logistics and e-health, we have pharma industry and medtech industry, and we have the specialists included in our association. The QualiCare means quality in chronic care, and we are working on to optimize chronic care for the patients in Switzerland. The idea is we do pilot projects to test the feasibility of implementing the best practices on a national basis. We promote patient-centered, interprofessional coordinated care, and we are combining all stakeholders along the patient care pathway to optimize the quality in primary care. Primary care is our main target population. So to optimize care, I want to say, like, working with others means not always working together, but for us, working with others means working together to optimize the care for patients with one or more chronic diseases. We always have a standard procedure. We either we analyze the gaps in care, or we see in some national strategy that there are gaps defined, and then we define the measures to close these gaps. Then we get together all the stakeholders to develop interprofessionally national practice recommendations using evidence-based guidelines, international or also other national guidelines. We conduct pilot projects to test the feasibility of implementing these recommendations in primary care. The problem is always that there are a lot of strategies, healthcare strategies, there are a lot of papers written, what one has to do, how to meet the gaps, but a lot of projects don't happen. A lot of papers don't get worked through because it's not feasible to implement it in the practice. And it's a lot of money that is paid to write all these strategies if they land into the drawers of the offices. So all these procedures working together and developing together in recommendations and also conducting pilot projects takes a long time. It takes much longer than if only one organization is responsible for following through with this project. So I would like to give some examples of what we're working about, as I'm also working for the Swiss Society of Endocrinology and Diabetology. Diabetes is always a very close topic for us also. The Swiss Society of Endocrinology and Diabetology, they are also a member organization of Quality Care, so they often propose projects to be conducted together through Quality Care with other stakeholders. There's evidence. There was a master thesis written on the evidence of the hospitalizations of patients with diabetes due to amputations. It was a quite striking picture. The Canton Vaud in Switzerland, which is like around Lausanne, they had a 10-year cantonal program on diabetes, and just by working together to prevent diabetic feet problems, they managed to reduce the amputation rate. As you can see on this slide, the red lines are the Canton Vaud, and the blue lines is the rest of Switzerland. So the rest of Switzerland, it stayed high, the amputation rate, whereas in the Canton Vaud, it went down. And after working in preventing the diabetic foot, the next step was also to help do the cure of the acute diabetic foot syndromes. Diabetic foot syndromes are diabetic foot ulcers, as well as Charcot feet, which is like a special syndrome for feet due to diabetes. The Swiss Society of Endocrinology and Diabetology, they asked Quality Care to organize and coordinate an interprofessional working group to develop guidelines, specific recommendations for the care of diabetic foot syndromes, as well as a practical guideline or guidance. Actually, we don't do guidelines because to prepare guidelines is a very large process, a very long process. We actually invited 12 different professional societies, medical societies, nurses, different medical specialties, nurses and podiatrists and pharmacists. At the beginning, the diabetologist asked me, why do I want to ask a pharmacist? But they did not know that in the pharmacy, you see a lot of open feet. And if the pharmacist does not react when there's a wound on the foot, the patient is lost, because by the time he will go to a doctor, it will be too late. And this is the biggest problem, that a lot of patients arrive at the wrong time, or much too late in the interprofessional foot center to get the adequate care. So we produced this practical guidance. It took about 18 months to work on it. We had subgroups working on interprofessional subgroups, working on each topic. And we produced this as a very good, very straightforward guide to see different levels. First level is the primary care, is the pharmacist, the medical technician, the podiatrist, the nurse, the wound care nurse, and the GP. The GP has a bit higher level because he is allowed to prescribe antibiotics in Switzerland, and therefore he could take care of the patient a bit longer, but not much longer, not longer than 1 month. So what's very important that we only have one guidance for all health professionals. We have different levels of care, but it depends on the competency of the person who is working with the patient. So if it's a red flag, you have to go to an on-site interprofessional foot team, and it doesn't matter if it's the pharmacist who refers or if it's the GP. This is usually, one says, like, the first line goes into first sends the patient to the general practitioner. That means if the wound of the foot does not close or get smaller after 2 weeks, we have to send everybody to the general practitioner. But if the pharmacist, for example, only gets the patient and sees him and the wound is already like 6 weeks old, the pharmacist is not allowed to send the patient to the general practitioner. He has to send the patient directly to the foot care center, because time is tissue. This is very important, and the patient risks an amputation if the wound does not get closed early enough. Another project we're working on is the optical multimorbidity. We got the Canton Vaud again in the Lausanne. They are very active. They prepared an interprofessional guideline for the optimal care of multimorbid patients, and this is a very general guideline, but they gave it to us, to Quality Care, to implement it in the primary care setting. So we are planning to do this. We're actually in the process of recruiting healthcare professionals and patients in Switzerland in 3 different regions. One very important part is we decided who is the core team. It will always be the GP, the medical assistant or nurse in the GP's office, as well as the pharmacist who's not in the GP's office. And every other stakeholder, every other healthcare professional around this core team depends on what kind of patient it is. If it's a patient maybe with mental health, you need maybe a psychologist or a psychiatrist or a neurologist, or if it's somebody who has addiction problems, you need a social worker with addiction background. So it's very specific, very individual. And what is very important is that from the beginning of working together, you have to define the roles and the interfaces, and the roles and interfaces can be very different depending on which setting we are in. And this is I want to thank you for your attention and for taking your time. Thank you. Back to you, Marwan.
Thank you, Astrid. Interesting work, like all the other things. Thank you. So we go now to our last part of the webinar. We have Jill Boone that will be talking about the Interprofessional Education Self-Assessment Tool. Jill is a clinical professor and interim chair at University of Cincinnati. She also serves as the Director of Interprofessional Education, and she is an Associate Director for the FIP Workforce Development Hub. Jill was the recipient of the Ohio Society of Health System Pharmacists Walter A. Fraser Award for Sustained Professional Contribution. Jill, the floor is yours.
Thank you, Marwan, and thank you to all of the speakers that have presented thus far. I'm excited to hear about the collaborative efforts throughout the world, and really feeds well into what we're going to be talking about for the next few minutes, which is an interprofessional education self-assessment and readiness tool that was developed by the working group of myself, Astrid, and Silvana, who you've already heard from. And we have a number of other collaborators, which I will acknowledge a little bit later. So I guess the first question on the next slide would be, why would we spend time in doing something like this? And we know that interprofessional education continues to expand throughout the world, because the future of, well, really the present and future optimal practice model is interprofessional collaboration. And so really to prepare us better, we know that we need to continue to build into all professionals to be able to work better together. There have been multiple interprofessional education competencies developed. I've listed Australia, Canada, Japan, the UK, US, all of which have developed specific competencies that lend into the skills and training for what's needed for interprofessional collaboration. And there's also a number of guidelines out there for how to implement this type of activity. But as we have reviewed the literature and really have looked around the world, what we realized is there was a gap. And we felt that FIP could really fill this gap by developing a tool where you could do a self-assessment and say, okay, these are the things I have strengths with, these are the things that I have gaps with, this is where I need to focus in regards to preparing to implement an interprofessional educational program. So we want to assist organizations and institutions on their road to interprofessional education and collaborative practice by developing this tool. It is a survey-style questionnaire, which is used to assess readiness. And I'm going to show you a couple of examples in a few minutes. So we are really focusing right now on health professional schools, universities that provide professional training. And eventually we would like to also add in a focus for practice sites. But for right now, as we developed it, we realized we really need to focus it fairly narrowly to begin with, and then build on it in the future. But we're really excited about providing this opportunity. And we are testing it in such that it will be applicable globally as well as regionally. So what we've done in the structure of this tool is we've broken it into some 3 levels that would, I think, make sense for most people, looking at what influences do we have at the national or regional level, depending upon where your regulations, laws, or accreditations lie. What strengths or gaps do we have at the institutional level or in your university setting? And then more at the curricular level or specifically within your program. So again, we've kind of gone from broad down to narrow in designing this tool. So this is the example of breakout again, and you can see a few questions here that for the institutional level, I'm going to start on the left side that says institutional or meso level for health education. My university has policies explicitly that support incentives for IPE, and we'll have a Likert scale in many cases, or a yes, no. My university has strong leadership committed to IPE or dedicated personnel. And a lot of times that would be yes, and a lot of times it will be not so much. And so immediately then you can start recognizing that this is a place where you can actually focus efforts in developing your IPE program. Okay, next slide. So what we've done so far, we started out with a literature review. We went to content experts focus group to develop a lot of questions. We've now narrowed it down to 70 questions. We've also had a global interprofessional review, and I'll highlight some of the people that we've had engaged with this process. We circled back and had some FIP expertise that have provided us review, and now we're in the process of doing a content validation. And we added Tim Chin from Australia, who's really been providing us the expertise in survey validation. And so as we've moved through this process, next slide really quickly. So as I mentioned, the literature review and the focus group and the interprofessional review, I wanted to highlight the fact that we've had not only pharmacy, but we've had medicine, nursing, PT, psychology, dentistry, sociology, and occupational therapy, to name a few that have been. And we've also been very sensitive to make sure that we've had all of the WHO regions represented in our review process to try to make it as broad and sensitive as possible. We also have tried to be very sensitive in this, the one FIP approach, where we have both practice, scientists, and workforce and education. Next slide. And so that we've really focused on making sure we have practitioners and looking at the practice aspect of this important tool, looked at the science about, especially of the validation, as well as the looking at long-term, the implications of this, and then the education, obviously, that this is a focused tool to develop this needed resources to implement an educational program. So as I mentioned, we have lots of people to acknowledge. These are a sampling of people who have been involved in some way throughout the process. And I just want to thank you. You'll need to see some names on here that are very familiar, even a part of this group today. So thank you very much. And we're looking forward to hopefully launching this in the next couple of months. And so you'll get to hear much more about it and hopefully be able to use it for your institution. Thank you.
Thank you, Jill, for this. And as you said, we will be hosting a webinar for the launch of this IPE tool. Thank you for all the efforts and for all the work. We will go now to Chris Jones, who is FIP lead for data and intelligence, and who has like some slides in order to talk about the GPO and the monitoring of the DG8. Chris, the floor is yours.
Thanks, Marwan. Hello, everyone. I'm going to be quick as we are short of time, but this is really about the monitoring and evaluation of FIP development goals and how we produce FIP development goal indicators to do that. The FIP Global Pharmaceutical Observatory is key to this, and its mission centers around data, intelligence, advocacy, and reporting. We know from the pandemic the importance of data, and for data to provide us with evidence, and for evidence to provide us with intelligence. Next slide, please. I'm not going to go through all of these outputs and influences, but you'll see on the screen now the FIP Global Pharmaceutical Observatory is undertaking a lot of actions and activities. One of the main ones for this particular session to focus on is the bottom bullet, which is about health system strengthening by tracking progress against the development goals. This is a particularly important activity. Next slide, please. Our projects are on the screen, and the big project that, and the reason why I'm here today, are the development goal indicators tools that we're developing, and as I say, to measure and monitor progress towards development goals, and in today's case, development goal 8. Next slide, please. So we're now seeking to develop indicators and country level metrics to measure and monitor progress and the performance of the implementation of the FIP development goals via the FIP Global Pharmaceutical Observatory. So in the last few minutes of this event, we would like to seek your support for this Global Indicators and Metrics project by contributing to a very brief activity, which we hope you will enjoy, that is linked to this development goal event that you have joined. And this will particularly show how we can monitor and measure DG8. So you'll also receive an email to complete this activity at the end of this event if you don't complete it now, but it would be very great. We would be very grateful if you could help us right now. And if you click on the link at the bottom of the screen now, I'll put it in the chat box as well, or you can scan the QR code. This will be great because we would really value your help and expertise in developing indicators and metrics, particularly for this development goal 8. So that's all I had to say, and thank you very much. I'll also put a link in the chat box right now so you can have a go at the activity. Thank you so much.
Thank you, Chris, and thank you, everyone. We're going now to close our session. Thank you for your time for filling the survey, the activity that Chris have mentioned. If we go to the next slide, I want just to announce that we have our episode 17, which is the FIP Development 5 Competency Development webinar on October 27. So be there. We will be launching the FIP Humanitarian Pharmacist Competency Framework, and also highlighting the importance of DG5 in workforce, education, practice, and sciences. On the next slide, please allow me to invite you all to our symposium. This was the first session of the symposium. We have another session in a few minutes after the opening of the symposium, and we have a full day tomorrow. So please scan the barcodes or use what we have on the chat box in order to register for the symposium. It is the Pharmacy Technicians Symposium. So we will have, we'll shed the light on many roles and that the pharmacy technicians are doing worldwide. We'll be talking about leadership, about the digital era, and how the pharmacy technicians are helping and transforming and providing the services to the patients. And the last session will be about unique roles of pharmacy technicians. So see you there, and thank you, everyone.